Hi, my name is Jordana Trausch. I will be presenting my Educated Citizen portfolio. So, the public issue I chose to talk about was eating disorders in Omaha, Nebraska. So, I chose this topic because eating disorders have I've been very passionate about throughout my whole life. I feel like eating disorders is a topic that kind of just gets pushed away and people really don't think about it. I know tons of people that have eating disorders and not a lot of them talk about it. People just feel embarrassed. They feel like, oh, why did it happen to me? Like, oh my gosh, they're going to think I'm a horrible person since I have an eating disorder. No, like many young teenagers and young women experience eating disorders because of social media, lack of knowledge, lack of support. I currently work at Children's in the Eating Disorder Day program, and I love it. I feel like there is not enough support, especially in Omaha, for young women to go to and to talk about eating disorders. They don't have enough knowledge. The in Nebraska, there's only Children's Eating Disorder Day program for young adolescents. They do have outpatient clinics, but they don't have any inpatient hospitalization for patients, which is really sad because eating disorders are becoming more and more problematic in today's society. My next, so this public issue talks about how you can have serious conditions that affect your physical, psychosocial, and social functions. Eating disorders affect about 9% of the population worldwide. So, during my nursing career at Methodist, I have learned to be an effective communicator. An effective communicator uses critical thinking to generate and connect and organize ideas in a written, oral, and nonverbal manner. So, my first experience about being an effective communicator was in Nursing 101. I had the opportunity to evaluate my communication skills when talking to a patient one day during clinical. This patient opened up to me a while after I was visiting with them and taking care of them. I chose to do this experience about skills I learned verbal and nonverbal. In this experience, I used active listening. I sat there and listened to the patient and just kind of listened to what they were experiencing. I learned that there is a big importance of being able to put put and go with your gut and feeling to provide the best care for possible for your patients while making nursing what makes nursing so special is our ability to use empathy to better understand what our patient is going through by reading their facial expressions or their body language. This experience has taught me to always go with your gut. So if I feel like there is something wrong with my patients, I'm like, nope, there is something wrong. I'm going to go with my gut feeling. We've learned throughout nursing school that every single nurse does not do the full head to toe assessment the same. We may see something different. And if we see something different and it's not in our normal range, we are going to go with our gut feeling. So, how I tied this in with my issue of eating disorders is being an effective communicator plays a major role in eating disorders. So, when you are taking care of patients with eating disorders, you need to make sure you're an effective communicator. I watch for both verbal and nonverbal skills when I am taking care of my patients. When I take my patients to the restroom, we have to leave a little door cracked for them just because we need to sit outside and we need to hear if they're like vomiting, if they're doing some sit ups, they can be doing some lunges, some squats in the bathroom. We need to listen and make sure that we hear that if they're doing this, we hear it. And it's important because we want the patients to get better and we want them to take in all the nutrients they are getting from the food. So we want to make sure they're absorbing it and they're not like exercising or purging. We want to make sure they are keeping the nutrients inside them. So my example number 2 of an effective communicator was that was in Humanities 150. During this experience, I gained better confidence when I was public speaking in front of a large group. By practicing my public speaking skills, it helped me when I was doing this presentation and preparing for it. Honestly, I'm not a big fan of public speaking. What I learned is it makes a great argument. In an argument, you need to be prepared. You need to be like, okay, I'm going to argue this statement. You need to be ready to present it. And you're going to use your public speaking skills. So, what I have learned from this is that being an effective communicator plays a major role in eating disorders. The patients that I take care of, they build confidence in talking to their peers and talking to professional workers about their eating disorders. They build that relationship with us and they build that trust. And they're like, okay, I trust you. I know you won't like judge me or anything. And they build the communication and they have to speak in front of their peers. They practice public speaking every single day. They have to present their like what they're struggling with and they'll have different topics they have to talk about. And so they gain that confidence of being a public speaker. So a reflective individual is someone who routinely engages in habits of inquiry that influence ways of thinking and action. So throughout my nursing career, I reflected as a reflective individual. An example was in 240. One day we got to see vaginal or C-section deliveries every clinical experience which was awesome. Loved it. So one day during clinical, a mom was having her third kid. She's like, okay, I'm having a vaginal delivery, thinking everything would be hunky-dory, everything would be good. But unfortunately, the child was breech and nothing went as planned. So we prepared for the best outcome. We were positive. And reflecting on this experience, I learned that nothing goes as planned. You had to be prepared for the worst. And that's what we did. We had doctors lined up. We had the NICU lined up just in case. And, everything was good. The baby was healthy. The baby didn't have to go to NICU or anything. And so then this ties in with eating disorders because mom needs to make sure that she is taking care of herself in order to take the best care for her child. So when moms are preparing to breastfeed, they need to make sure that they take in 500 extra calories a day in order to help the baby maintain their weight and make sure they're getting adequate nutrition. And the mom also needs to take in adequate nutrition as well, so she's making sure she gets enough supply. So with eating disorders, people tend not to eat enough. So we educate mom that this is the time where she needs to take in those extra calories and it will help her and both the baby. Another example was in 340. So what happened was that the mom had tons of questions and she was asking, making sure that her baby was getting enough nutrients with the NG tube feeding because the baby kept vomiting. So what I learned was that you need to be open up with what your patients and family members are telling you, and they have a concern, you need to look into it so that you are taking care of your patient. And for this example, the mom wanted the best care for her child. So how this ties in with eating disorders is that being a reflective individual plays a major key in eating disorders. It is important that we do not judge our patients for having an eating disorder. We need to build that connection with them so they can trust us that we are doing what is best for them. They need to have that trust with us, making a food plan and talking through this to help them feel better. By having that trust, we will build key relationships and they will be able to trust themselves. So when they eat a plate of spaghetti, they know that they are getting the adequate nutrition because we plan that based on their diet needs instead of looking in that mirror and feeling like, oh, I'm fat because I just ate a whole bowl of spaghetti. So another example that we learned during nursing school is to be a change agent. A change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop cultural competence and to take adequate initiative to effect change. A change agent that I experienced was in 210. During this experience, what happened was an example is where I demonstrated empathy, compassion, and desire to help someone who had a different racial, cultural background than I did. So I was taking care of a patient who was African American and who was in a hospital for neuro problems. The patient was so sweet, and they listened to me. They followed the direction. I listened to them, and their end of their goal was that they wanted to go home and they wanted to heal fast. So what I learned was that when I care for patients, I treat them like they are my family member. Like I take care of older patients. I pretend I'm taking care of my grandparents. I just want the best for them and I want them to get the best help they can. So their end goal that they can go home and live their everyday life. So how this ties in with my public issues of eating disorders is that eating disorders, because of the cultural and background, plays a significant impact on how someone eats and how it affects them. So when we are planning our meals for patients with eating disorders, we make sure, okay, do they have foods they like, dislike? Can they eat meat because of their cultural background? And more Caucasians are more likely to have eating disorders, and so are females. This is due because social media plays a major impact on females and their body image. So when we are taking care of patients with eating disorders, we need to make sure that we are being great role models, we're planning their diets adequately, and we do not judge them. So in Nursing 350, I experienced being a change agent. During clinical one day at Lasting Hope, a patient was experiencing a rough morning and did not want to take their medications and just wanted to continue sleeping. The nurse and I explained to them by taking their medications will help them feel better. The sooner they get to feeling better and doing better, they would get to go home and see their loved ones. The nurse told the patient once they took their medications, they could go back to sleep. The patient listened to the nurse and fell back to sleep. Later that day, we went to check on the patient. The patient looked very depressed and started crying. I asked them what was wrong. They said that they just missed their family and wanted someone to talk to. I sat with them and listened to them just explain their feelings and what was on their mind. I learned from this that everyone needs someone to talk to no matter what they're going through. Every situation is different and we should never judge anyone. How this ties in with eating disorders is that we never know someone's full background. Like from meeting someone on the street, I wouldn't know their background. They may look like a really skinny person, but I may not know their social life, their culture background, what they've been through in life. So when we meet someone, we should never, ever judge them because we don't know their background and their story. So, becoming an educated citizen, I have learned to be an effective communicator, a reflective individual, and a change agent embodies the educated citizen, which has empowered me to be a great nurse in a couple of months. I have learned about public issues that help me use my knowledge of the educated citizen to address eating disorders or other issues that patients may face. These experiences have shaped me to the person I am today. I cannot wait to help educate and help people struggling with eating disorders become a better person because I'm a more educated citizen. Thank you for listening to my presentation.